Minister. Hello, everybody. This is Dr. ADAMOLOGY here on Elevated Voices on Believe Radio. And today I have a guest, but she's not a guest. She's part of the family. She's part of the Believe family. One thing about Believe Radio, I wanted to tap into more things besides music, especially for our community. And one of the pieces I wanted to add was health, a health segment where you can learn things about from your body to mental health, all these things. And so with that, we have this special lady with us on the day who's part of Believe Radio. Her show is called Ask Dr. Cobbs. She is a Bay Area native. She is a minister of music here in the city of Oakland at Harmony.
That's correct.
I almost said Harmony Church of God in Christ. Harmony Missionary Baptist Church. She is I'm going to see if I can say this right, a DNP.
Yes.
Yes, I got it right. So without any further ado, I want everybody to put your digital hands together and welcome Dr. Yvonne Cobbs.
Hello, everyone. Let me explain what a DNP is. A doctor of nursing practice. I'm a nurse practitioner certified, and I'm adult nurse practitioner certified, and I am duly, I have 2 degrees. One is in psychology, and the other one is in medicine, internal medicine. So I am a nurse practitioner with a doctorate degree in nursing.
And so we have professionals here at Believe Radio. And so one of the items that, and I'll probably get to this on the back end. So let's start from the beginning. Share with our audience again, how did you get into nursing with all the, because number one, you are musically gifted. So she sings at the Christmas event that's actually coming up.
Soulful Christmas.
Soulful Christmas. Are you one of the executive producers?
I'm the music director for, this is year 11.
The music director for
Lorraine Hansberry Theater.
Yes, and that's in the city of San Francisco. So she wears these music hats and everything. So what made you decide to go into nursing?
Okay, so actually it's going into medicine. My mother and father found that as a child, I was dissecting everything. I remember, I think age 4 or 5, I got my first microscope, and then I start looking at everything through the microscope. They saw that gift. And my father, he always said, my father was a pastor, Pastor A.L. Cobbs Sr., Harmony Baptist Church. And he always said, you can sing, but you need to get something up under your belt other than singing, so that it can, if something happens to your voice, you can fall back on something. And nursing, actually, I went to Skyline High School in the medical track for MD. And my English teacher at that time told me that I could not be a doctor because my English, I think it was a paper I wrote and she didn't like it. But I never told my parents, because my parents always taught me I can be whatever I wanted to be. Beyond the sky is the limit. But because she was a teacher, that kind of threw me a little bit. So my track got thrown off just a tiny bit, but I still stayed in medicine. I went to medical assistant school. I became a medical assistant. This was a very, very long time ago, because I've been a registered nurse for over 30 years. I've been a nurse practitioner for 25 years, and I've been a DNP for 5 years. So I've been in this field for a very long time. And from there, I started working at San Francisco General, and they paid for my school from nursing.
All right.
And it was just from there, it's just elevation.
And this is really important because, especially in the African American community, sometimes we don't know
Yes.
that we have medical doctors, medical nurses, all right, in our community. So Bay Area, we have a professional, medical professional that you can get a hold of. And so when it comes to Ask Dr. Cobbs,
Yes.
your wonderful segment that, I mean, she deals with men. She talks about us, y'all.
Yes, I do.
She gets on our prostates. She gets on cancer,
The
heart, stroke,
Mm-hmm.
and
Diabetes.
And so it isn't just like, oh, it's just for the women. No, no, no. She taps into the men. So you being holistic,
Yes.
what level of focus and things that you have to even come up with these segments? Do you work on it for a whole week and then say, okay, now I'm going to record? So what level of focus you have for your segment? Ask Dr. Cobbs.
So my ears are open to the community, and people always ask questions.
Mm-hmm.
And I'll go, that's a good question. Let me put that on Ask Dr. Cobbs. And that's how I come up with my segments every weekend. I don't ponder over them. I get them. Somebody will ask a question, and I will answer that question through that segment.
Because I tell you, there was things, even you dealt with depression,
Anxiety.
you dealt with anxiety. I mean, mindfulness, practical application. And so if you wouldn't mind, can you just share one about anxiety? Because again, I think that one, especially right now, people are dealing with SNAP benefits and all those, they may have some anxiety. So from like Ask Dr. Cobbs, what would you say in your segment?
So I would say that anxiety and worry are two different things. Anxiety interferes with sleep. It interferes with the way you operate on your everyday life. It causes you to go to the hospital with heart palpitations, thinking you're having a heart attack, or sweating. Where worry is when the situation is over, then the worrying stops. But with anxiety, it just keeps going. It could be over. And sometimes it may not be even a reason behind it, but you feel doomed. Like something is going to happen and you can't control it, and you're trying to control it. So anxiety have a lot to do with trying to control what's going on in life.
That is extremely interesting because I would not have connected anxiety per se to sleep. I think when I think anxiety, I'm thinking you're just nervous. You just got nervous energy, and you just like, oh my goodness, I'm worried. But anxiety actually has characteristics.
It has characteristics, and some of the characteristics is insomnia, not being able to sleep. That's because your mind keeps going. You can't stop your mind. Another characteristic is sweating profusely in either your hands or just sweating. Another characteristic could be lack of appetite or overeating. Everyone's different. Everyone has, and then sometimes you have the heart palpitations. A lot of my patients, they go to the emergency room because they think that they're having a heart attack, but it's anxiety.
So going back to this is things that she's articulating in her show, Ask Dr. Cobbs, here on Believe Radio. And so show them or share with them some of the solutions that you give on your show about dealing with anxiety.
So some of the solutions for anxiety: deep breathing. Deep breathing. Not only deep breathing, but breathing in maybe 7, breathing out 7, breathing in for 5. So you can go from 7, 5, 3, and because what that does, it slows your heart down. It slows your heart down. It slows everything down a natural way. And then some other things is to focus. Focus on something that you hear. Focus on something that you see. And focus on something that you can smell or touch. And then actually going through that, and just that focus brings your mind to something else. And then another thing that you can do is just recognize that this is anxiety.
Mm-hmm.
Once you recognize what it is, then you can do something about it. That's like if we recognize any problem, we can do something about it. But if you don't know what it is, then more panic happens.
So when you talked about the second solution, which was the focus.
Mm-hmm.
So just make sure I have clarification. So it's like I'm using my imagination. And
I don't want you to use your imagination. Okay. I'm gonna bring you through it really quickly.
Okay.
Right now, I would like you to focus on something you can see in this room. There's something you see in the room.
Okay.
Okay. I want you to focus on something you hear.
Headphones. Mm-hmm.
Okay. Now I want you to focus on something you can touch.
Table.
Okay. Now that brings your brain into a different dimension, because now you're not thinking about things, or your brain that was actually racing has now slowed down.
Because you gave these items for it to focus on.
It focused on something else.
Did you all get that? See how easy that was? See how simple that is? So you should be having panic attacks. You shouldn't be having anxiety attacks. Look at something, then hear something, then touch something. Wow.
And then they have meditation. They have the meditation YouTubes that you can, and they have the different YouTubes. It says YouTube for anxiety, 5-minute relaxation, or 3-minute relaxation, 10-minute relaxation. Throw that on, and it brings you through not only the sounds, but it will also talk you through.
Now that's what you call YouTube and YouTube University.
Yes.
Well, you whatever you need, just type it into the search engine. And I never would have thought about that. Never would have thought about that. Yeah, that's good stuff. And so let's do one more, because especially dealing with men, because I'm a guy. So deal with the share something from your cancer segment that you do about men and cancer in their body.
Okay, so let's talk about men and cancer. So first of all, in men of color, our number one cancer is prostate cancer. So men, I'm speaking to you. If you are 50 or older, please ask your doctor to do a PSA. PSA, that is a blood test. And they can see what your numbers are, okay? And then if you have cancer in your family, prostate cancer in your family, age 40, ask your doctor to do a PSA, okay? If you are urinating, can't empty your bladder, or having blood in your urine, go ask for a PSA, or go to the doctor and see what's going on. Just don't let it go. Because sometimes we let it go, and African American people and people of color tend not to go to the doctor and just continue to have the symptoms, and then when they actually go, it's too late.
Now that was good. PSA. Men, did you hear that?
Prostate surface antigen.
That's what that means.
Yes.
I didn't know that. PSA. So these are the type of items you get in the health segment that we have now on Believe Radio through Ask
Dr.
Dr. Cobbs. And so I like the theme song. I didn't get a chance to cue it up. But I was about to have some time to cue it up. Ask Dr. Cobbs.
Your health is your wealth.
Dr. Cobbs. Hey. Yeah, when you listen to the radio station through the app or the website, you'll be able to catch Dr. Cobbs every hour. Once every hour, we have a Dr. Cobbs segment on our rotation, so you can listen. And then it's like music. Ask Dr. Cobbs, and then we go to another hour, music, and then ask Dr. Cobbs. So you can actually hear these medical tips that will change your life. And that's what we need. We need information that will change our life. So is there anything you would like to share with the audience before we conclude this wonderful session?
Well, I have a clinic, and it's in Pinot, 1063 San Pablo Avenue. And I have a machine. It's called Stem Wave. It's not covered by most insurances. Well, actually, it's not covered by insurance. But we can talk. It decreases inflammation, which causes pain. And a lot of us are in a lot of pain. It may help. The other thing, you may have seen the viral super patch, freedom patch, liberty patch, where it helps with balance, strength, and pain. Your girl got it for the Bay Area. So, it's easy to contact me. You can either contact me at the clinic, 510-964-9275, 510-964-9275. Also have a website. It's www.healthylivingclinic.net. And also you can contact me through healthylivingfoundation.net. Or you can just call.
You said something before we go. I really want you to tap into, because we hear this term a lot, information. And so a lot of people hear that term, the doctor says it, but what's the definition? Then what's an example so people can, understand that term, so they know they may have too much of it and why they're having all these issues in their body?
So I'm going to focus on inflammation for pain. So inflammation is any swelling that you have. Okay. Any swelling that you have. For pain, that's our body's natural response to tell us that something's wrong. Okay. So every pain that you feel, that's a natural response. Just like anxiety is a natural response. It tells you that something is going up, something is going wrong, or something is up. So the same thing with inflammation. Something is up with your body. Now, back pain. You have back pain because of the swelling around your nerves. Okay? You have leg pain because there's some swelling either around your muscles, ligaments, tendons, somewhere around there. You have knee pain, and someone says, I'm on bone. Okay, but you're bone on bone, but that the pain comes from the swelling of the knee, and the machine gets rid of that swelling.
That level of breakdown I have never heard. Inflammation
is swelling.
So I know something is wrong due to the swelling.
And when you say ouch, you know something's wrong. Your body is giving you that warning. It's saying, hey, something's wrong. Pain is a warning. Something's going on. So if you ignore that warning and it gets worse, your body said, I told you.
That's some good stuff. That is some good medical tips, advice, because some of you, your ankles are swollen. That means you have some what, class?
Inflammation.
And so something is wrong. It isn't, everybody in the family has it. Well, if everybody in the family has it, something is wrong.
Right. It could be your heart.
Ooh.
Left side goes to the lungs, right side go to your extremities. That means your legs.
So, tap into that real quick because you just said something went over my head. Say that again.
So when you have congestive heart failure, with congestive heart failure, left side goes to your lungs. You get congested in your chest and in your lungs. Right side goes straight to your legs and your ankles.
Wow.
Something just to look at. Why is that inflammation there?
Wow. So if you're having inflammation, which is swelling in your
ankles or your legs,
that lets you know that the right side
of your heart may not be working correctly.
Wow. That's heavy. That's good. That's preaching. That's good.
Is that something to preach on?
That's good. That's good. So again, you can get all these type of things every single day on BelieveRadioBayArea.com and tune in and listen to Ask Dr. Cobbs. She comes on every hour with about 3 to 5 minute segment on the station every hour. Every hour you're getting a dose of information, dose of health tips, dose of medical advice. And then again, if you want a one-on-one appointment, a one-on-one, because you enjoy the radio piece, but you really have some personal questions, go to her clinic. And I've been there. The clinic is in Pinole.
It's in Pinole.
And it's a Black-owned clinic. It's like, oh, this is here.
It's my clinic, y'all.
Yeah. It's her clinic.
And they say that how can a nurse practitioner have their own practice in California? I'm one, and I'm recognized by the Board of Medicine.
Come on. Right here in the Oakland, San Francisco Bay Area. African-American woman. I think you're the only one.
There may be some now, but I was the only one because I've been open for 13 years.
And she has, once again, that experience working in San Francisco General. So, again, ask Dr. Cobbs. And if people want to reach out to you via email, what is your email address?
Admin, ADMIN, at healthylivingfoundation.net. ADMIN at healthylivingfoundation.net. Just go to my website and leave me a message.
Because that information piece, right side, left side of the heart, that was so good. That's so good because with the holidays coming up. And so if you see an uncle and his legs is really swollen, something is going wrong with the right side
of his heart. And it could be, and then it could be it's something else, but I'm not gonna
but that's a start.
Yeah, that's a start. Just get your heart checked out.
And if it's in the chest section, there's inflammation, there's swelling there, that's a sign of the left side of the heart.
Right. If you have congestion bubbling in your lungs, that could be left side. Just for you don't have a cold. Just for no reason, all this stuff is in your chest. Go get it checked. Go get it checked out.
Is that talking about even like mucus, like yellow mucus, brown mucus?
Actually, it rattles in the chest. It doesn't really come up.
Oh.
Because it's in the lung. It's deep down in the lungs. Because you can't even cough it up.
Wow.
Because if you can cough it up, then it'll come out. But it's from a leaky valve on the left side of your heart.
Wow. But again, all of this you get every day on Believe Radio Bay Area. You get it with our health segment, Ask Dr. Cobbs. And so I wanted her to come in so you all can see her and hear her, because this health piece is so necessary. Because, people are dying left and right and don't know, but these signs have been here. the signs have been talking to you for maybe a couple of months to a year. Just been, you know, and you've been having that feeling in your chest, and you can't cough nothing up.
I just want to. I was at. I'm not going to say where, but I was at a convention, and I looked down and I said, "Hey, your legs. His legs are swollen." And I asked the other nurses from this state, and I said, "Reach out to him because there's something going on." That was a Saturday night. Sunday morning, I said, "Hey, did you reach out to him?" And they were like, "No, we got busy." And I said, "Please reach out to him. There's something going wrong." Well, the young man passed away that evening.
And the signs were there because he had swollen ankles.
I mean, they were so swollen that they were kind of like oozing over the shoe.
I have seen stuff like that, especially in church.
Wow. Go get checked out, people. You know, they call Christians the walking dead because we don't take care of ourselves. You heaven bound, but we're not taking care of ourselves.
So again, if you want more knowledge, medical health knowledge, tap into Ask Dr. Cobbs. And you can even Google Ask Dr. Cobbs because she comes up in a Google search. And so again, you can listen to her every single day on Believe Radio. And I want to thank you.
You're welcome.
For joining us, because you have definitely made a difference. I mean, even my mother listened to your segment. We all know who Ask Dr. Cobbs is. And so I thank you all for joining me here on Elevated Voices. This is Dr. Adamology here signing off and say make sure you tune in to our radio 24 hours everywhere you go. You can listen to Believe Radio, Gospel Music, and also Ask Dr. Cobbs every hour. Until next time, stay healthy and stay safe.
That's